This month is Women's Health Month, and in to join us from the Richland Hospital today is nurse practitioner Allison Ewing. Allison, good morning.
Good morning.
Great to have you in here. Why is it an important month in your eyes?
So there are a number of reasons why Women's Health Month is important. Primarily a big thing that we focus on during Women's Health Month is preventative care screenings. So mammograms, pap smears, bone density screening, all those kinds of things that become increasingly important as we age.
Certainly things that we don't think about, though, are things such as heart health, right?
Yes.
That comes into play as well?
Yep, that's also important as well. So basically, the recommendation is that ages 18 to 39, people come into the clinic to see their regular provider, primary care provider, every 1 to 3 years. After age 40, we like people to come in annually, and at those checks, we do monitor, blood pressure. We usually do blood screenings such as cholesterol checks, checking for diabetes, screening for thyroid disorders, and then, of course, the other preventative care things that I mentioned earlier with like mammogram screening, pap smear, bone density screening.
Very important for mental health, too, I'm sure, isn't it?
Yes. Usually once a year we do touch on mental health and kind of do a screening on where things are in terms of any signs of anxiety or depression. Absolutely.
Does the Richland Hospital offer different classes and different things like that you can be a part of to learn a little bit more?
So I think touching base with your primary care provider would be the best thing because they might have, classes that would be most beneficial for you. As far as any general classes, they do offer things like Senior Life Solutions, which offers mental health support for people on Medicare generally, and then they have some other resources in the community. I'm not sure about any particular classes that they offer as of right now.
Just check with your primary caregiver, right?
Yep.
Exactly. So are there some things that you'd like to focus on today that we haven't talked about?
Yeah, I think maybe just some things on some of the screening recommendations. So it used to be they started pap smears by age 18, and we did them every year. Now, primarily that's looking for HPV, which can contribute to certain types of cervical cancer. In recent years, they found that actually going longer periods, sometimes some of that would clear on its own. So they do recommend now we start screening everyone at age 21. So that's a change from previously when it was age 18. And then there's kind of an algorithm that we follow. If, the pap smear is normal and the HPV is negative, then we generally do every 3 years until age 35, and then it goes to every 5 years. However, if one of those things would come back worrisome, sometimes we do monitor it annually. So again, just kind of making sure you get in to start those screenings, definitely at age 21, and then following up on the every 3 year, every 5 year, per the recommendation of your regular provider.
What about family history? Does that come into play?
Absolutely. So family history can come into play, especially with breast cancer. Specifically, we usually start screening women at age 40. However, in recent years, we are seeing people develop breast cancer at an earlier age. So, and maybe it's just because there's better detection. It's hard to say as far as that, but the recommendation is if you have a family history, a lot of times they'll start screening you 10 years prior to when your family member had breast cancer. So that is an important thing, definitely something to talk to your primary care provider about if you do have that family history. Same with colon cancer screening. A lot of times if there's a family history, we adjust those recommendations as well.
I know for colon cancer screening, in fact, we've talked about that on this program here this year.
Yep.
Is it the same for men and women, Allison?
Yes, that is pretty much the same.
The recommendations for when you should
recommendations.
Start?
Yep. It used to be age 50, and now a lot of times they're leaning towards age 45, unless there's a family history or concerns.
So that's another thing to look at.
Yeah.
Another thing I'm sure you encourage is just to get up and do a little moving and grooving, right? Moving the body around a little bit.
Absolutely. The recommendation is generally that we get 30 minutes of exercise 5 times a week. But I think especially for women, because they can be more prone to osteoporosis, and particularly Caucasian women, any strength training exercise you do will help strengthen your bones. So of course, like getting adequate calcium, vitamin D is important, but doing strength training exercises, so anything that incorporates weights, yoga, tai chi, those kinds of things can also be beneficial, will just help with that bone strengthening and help prevent fractures down the road. And as we know, fractures, especially as we age, could have increased complications, problems, especially when it turns into like a hip fracture or something significant like that. So prevention is always kind of the best choice.
Do we see a higher amount of cancers in our area, in women particularly?
I don't know as far as in our area versus other areas, but I do know, like, statistically, I was actually reading some statistics before I came that about breast cancer, we are seeing it diagnosed kind of younger and younger. It's becoming increasingly common for women in their 50s to get breast cancer, whereas we used to not find it until they were older. But again, it's hard to say, is that because we're screening earlier now, so we're just catching it sooner, which is beneficial, and a lot of times people have a better outcome when we're catching it earlier. But as far as if we have a higher incidence than those around us, I'm not totally sure on that.
Mm-hmm. Any opinion on why those cancers develop at a younger age these days?
So it's hard to say, but again, it might just be because we're screening, so we're finding it younger. Mm-hmm. Our screenings are becoming better, so maybe we're more easily able to detect it. But certainly, I'm not even sure on that, to be honest with you, but basically we are seeing it happen earlier, and it's hard to say if there are things in our environment that we're being exposed to that could be contributing. Family history. They are also learning a lot more about, like, the Human Genome Project, so a lot of times now with people who have a high risk for some of these cancers, they can do genetic screenings. Now, we certainly don't know everything about the Human Genome Project, so certainly there could be genes that we don't even know about that could contribute to cancer. But it used to be we only knew about BRCA1 and 2 to predispose individuals to breast cancer, for example. But now, at least last I checked, I believe there was like 14 or 16 genes that they could screen for that could not only predispose you to breast cancer, but ovarian, colon, pancreatic. So that's been really interesting, and hopefully they continue to, we'll continue to see developments on that with time.
We talked about family history, Allison, but is it important to talk to your mom or your grandma if you're able to?
Yes.
About the family tree?
Absolutely. That's definitely one of the things that we would recommend when people are getting ready to come in for their annual wellness, to kind of have a list. If you have questions or concerns, don't hesitate to write those down in advance so you don't forget about them when you're there. Bringing a list of any medications or supplements you're on, and then if you can, talking to your family about any family history, especially parents, siblings, and children. If one of them have something that's been going on, it's super important to bring that up to your primary care provider in case it could be something genetic that we need to look more into or do screenings for.
On the other hand, sometimes you find somebody that has an issue, cancer shows up or whatever, and they have no family history.
Absolutely.
There's not a rhyme or reason sometimes.
Right. Sometimes there isn't. Absolutely. So that's why they do the early prevention for everyone for a lot of these things. But you're right in that sometimes you can have a clean family history, no history of it, and still develop something.
What about diet? Do you get into that? Nutrition and those kind of things?
Absolutely. So we have kind of what we call the Get Fit program at the Richland Hospital. And actually, Dr. Dickman and myself kind of head that up. So that is especially important for women because as we age, women just have more estrogen. So that encourages fat storage. Men tend to have a higher muscle mass, which helps them burn more calories even at rest. So especially as women age and enter menopause, estrogen levels drop and muscle mass tends to decrease, which results kind of in a lower metabolism. So there are lots of things that we can do to help women with weight loss or doing testing if there are concerns for hormone issues or even perimenopausal symptoms that might go along with entering menopause. A lot of times people who have the best success with losing weight are focusing not only on like lifestyle changes, diet, exercise, but we do have some medications that can be used to kind of kickstart metabolism, and going in to see your primary care provider would definitely be a good way to find out if that would be an option for you. Also, we have nutritionists up at the hospital who will do consults and kind of help people with that dietary component. We talk about it a lot in the clinic. So yes, weight can play a big role, especially for women as we age. It just becomes harder to lose weight because that muscle mass decreases. So that's another thing that can always be brought up with your primary care provider. We're happy to see you for that anytime.
As we always say, it's nice to set lofty goals, but probably more realistic to say, okay, yes, I'm just going to do better, eat better, exercise, and then see what happens, right?
Yes, absolutely. And sometimes setting those lofty goals becomes very discouraging. Sometimes I'll have patients set a goal of like, I want to exercise exercise every day. And I always try to encourage, set a small goal at first, because you can always go up from there. But when you set it so high, life gets in the way and it can be hard to meet that. So absolutely, like setting those small realistic goals that are attainable are excellent. And you're right in that it's not even so much about the number on the scale. Sometimes I'll have people with a very specific weight that they want to be, but really it's more about like how you feel in your own skin, the activities that you can you do the activities you want to enjoy? Are you able to like splurge once in a while still maintaining that weight without fighting, like exercising 3 hours a day to maintain that?
What about good sleep? Because I know as a guy, that's one of the things that kind of changed my life when I figured out what was going on and, did the sleep study and all that stuff. But I'm sure it holds true for women too, doesn't it?
Yes, absolutely. Sleep is so important. Sleep can impact so many things. As you probably know, when you're not sleeping well, everything seems more stressful and worse. Like problems just seem bigger. So absolutely, if you're not sleeping well, there's lots of things we can do in terms of like screening for sleep apnea. A lot of times people with underlying like anxiety or depression might be struggling with sleep, restless leg syndrome, chronic pain. So there's a lot of things that we can do to kind of treat those underlying conditions and help with sleep.
You said screening, and I thought of screens, too. Screen time is probably an important thing to kind of monitor, isn't it?
Yes, we monitor that a lot, I would say, especially with the younger generations. And that was so much easier to control before so much started to be done homework in schools on tablets, computers, devices. So really, that's a big thing we talk about, especially with children at their annual wellness exam, is really trying to limit to that screen time. The recommendation is for school-age kids is no more than 2 hours a day, which adds up quickly, even if you consider TV, computer, anytime you spend on your phone. So it's nice that the phones give us those weekly reports. But yeah, there's a lot that parents can do, though, in terms of setting parental controls that will control that a little bit and shut the phone off at a certain time from any type of screen time. I'm sure you can still call, but yeah.
Women through the decades, too. I think about my own dear mother, and she had me, and it was 50 years before she went back to the doctor.
Yeah.
You know what I mean?
Yes.
And we finally got her to go.
Yes.
But I think that was more common back then, wasn't it?
Yes. And I think women in general, especially moms, are spending so much time taking care of everyone around them that they aren't really always taking care of themselves. And it's kind of one of those things where, they say on an airplane, you should put your oxygen mask on before you put anyone else's on, because you're not going to be any good to anyone if you're not here. So definitely encouraging women to go in and get those annual exams done, those screening tests done, just to make sure that we're keeping them in their best health so they can continue to take care of their families.
It's important this month, Allison, but it's important the year round, isn't it?
Absolutely, yes.
Yeah. Anything else you'd like to add today about our conversation?
No, I think the one thing I would just add is that we, in the past, used to only do screening mammography here at the hospital. So that meant that if maybe they didn't get enough images, if there was a concern, they would have to go on somewhere else, oftentimes UW Breast Center or wherever insurance covered, to do a diagnostic mammogram to get additional images. We actually are capable now to do all of that at the Richland Hospital. So we do screening mammograms Monday through Friday. If there's something abnormal, we can bring the patient back in for what we call a diagnostic mammogram, which is just getting more images. We do breast ultrasounds here. Generally, if that's the case, they speak to the radiologist that day that they are here for those appointments, so they're getting some answers, and then we coordinate care and set up any follow-up that they might need regarding that.
Are those better than they used to be?
It is still somewhat uncomfortable, but I do think that's gotten a lot better. And we now have like the 3D mammograms, so imaging is just better than it used to be. Absolutely.
Yeah, start with your primary, right?
Yes, start with your primary care provider, and they know your history and your background, and they'll be able to kind of give you specifics about where you should go and what you should do as far as preventative care screenings and treatment of any health problems you have currently.
That's a great place to start. Sometimes places like WebMD and things like that can get you a little bit concerned.
It's tempting.
Yeah, it is tempting. I know that.
Yes, but absolutely. Just go into the clinic anytime you have a concern. We're happy to see you, listen to you, and kind of go from there.
Great. Thanks for coming in. Thanks for your expertise today.
Yes.